Many people believe that a stroke always comes with glaring symptoms, but the truth is that there is a silent, sneaky, and extremely dangerous form that goes unnoticed even by people who consider themselves healthy. In this video, you will discover why this type of stroke might be happening without you noticing, and what subtle signs might be appearing in your day-to-day life without receiving due attention. Stick with me, because what you are about to understand can literally change the course of your health. And what is most striking is that this danger mainly affects men and women over 50, who often attribute the signs to the effects of aging. But ignoring these warnings can be costly. In the next few minutes, you will see how to identify a silent stroke early and avoid serious consequences in the future. So take a deep breath and get ready, because the first warning might be much closer than you imagine. What a silent stroke is and why it goes unnoticed. A silent stroke happens when a small area of the brain suffers an interruption of blood flow, but the signs are not intense enough to draw immediate attention. In many cases, the person continues their activities normally, believing that nothing happened. The problem is that, despite being small, this type of event leaves internal damage that accumulates over time, affecting memory, balance, and even behavior. It is precisely this lack of clear symptoms that makes the silent stroke so dangerous. Another important issue is that, because the signs are subtle, many end up confusing them with stress, tiredness, or natural changes of age. But the brain doesn't forget the impact. Each silent stroke increases the risk of a major stroke in the future, the one that can bring severe and even irreversible consequences. That is why understanding exactly what it is and how it acts is the first step to protecting your health and anticipating risks. And in a moment, you will learn about the first warning that many people ignore, but which can be decisive for identifying the problem in time. If this content is already helping you understand your health better, take a moment to leave your like and subscribe to the channel so you don't miss the next warnings that can protect you. Alert 1. Small memory lapses that seem common. Memory lapses tend to be one of the signs most ignored by people, especially after age 50. Most believe that forgetting where they put their glasses, repeating a question, or losing the thread of a conversation is something normal for their age. However, when this forgetfulness starts appearing more frequently or happens suddenly, it is a warning that cannot be underestimated. Small damage caused by silent strokes can affect areas of the brain responsible for recent memory, and this usually occurs before the problem becomes more serious. Another important point is noticing if this forgetfulness is accompanied by difficulty learning something new or concentrating on simple tasks. Many people only realize something was wrong after a long time, when the episodes have already become constant. Attention to detail is fundamental. Even if they seem like common everyday situations, the brain is giving signs that it needs care. And in the next topic, you will discover another warning that usually goes totally unnoticed, but which can indicate that something serious is happening. Alert 2. Sudden difficulty maintaining balance. Many people attribute a momentary loss of balance to a passing dizziness, a change of position, or even a lack of attention. However, when this happens suddenly or frequently, it can be a sign that small areas of the brain responsible for coordination are being affected. A silent stroke can compromise regions that control fine movements, posture, and spatial awareness, causing the person to trip more, feel instability while walking, or have difficulty getting up from a chair without wavering. Another important detail is realizing when the loss of balance arises without a clear reason, even on quiet days. This change can come accompanied by a slight sensation of disorientation, as if the body isn't responding immediately to commands. Often, the warning appears so discreetly that the person simply ignores it, but it can be one of the earliest signs that the brain is suffering impacts. And if you thought this warning was important, wait until you hear the next one. It is even more subtle, and many people confuse it with simple tiredness. Alert 3. Subtle speech changes that many confuse with tiredness. Discrete changes in speech can arise as a slight difficulty pronouncing words, small unexpected pauses, or that sensation of being tongue-tied without reason. Often, the person attributes this to the fact that they are tired, have talked too much that day, or are stressed. However, when these episodes happen occasionally and then disappear, it is important to pay close attention. A silent stroke can affect areas of the brain responsible for articulation and speech fluidity, and this is one of the signs that goes most unnoticed precisely because it is temporary. Another point that deserves attention is when a family member notices that speech seems a bit more slurred or that the person takes longer than normal to respond. These details, although subtle, say a lot about neurological functioning. If ignored, they can evolve into more serious problems, like permanent communication difficulty. In the next topic, you will see an emotional warning that is often confused with something psychological, but which can originate in the brain. If this content is helping you recognize important signs, support the channel by leaving your like and subscribing to follow the next warnings that can protect your health. Alert 4. Unexpected mood and behavior changes. Sudden mood swings can be easily attributed to stress, tiredness, or even daily worries. However, when a person starts showing sudden irritability, unusual impatience, or unexplained episodes of sadness, one needs to look closer. A silent stroke can reach areas of the brain linked to emotions and behavioral control, provoking transformations that surprise even those around them. These signs can appear mildly, but represent an important warning that something isn't working as it should. Another point that deserves attention is when these changes come accompanied by apathy, discouragement, or lack of interest in activities that were once pleasurable. This type of alteration is usually perceived mainly by family members, who notice the different behavior even before the person themselves realizes it. When the brain suffers small damages, the way of reacting to the world also changes. And if these signs have already caught your attention, await the next one, because it reveals a very common physical symptom, and one that many people ignore completely. Alert 5. Recurring discrete tingling on one side of the body. The sensation of tingling, especially when it always occurs on the same side of the body, is one of the most typical and, at the same time, most ignored signs of a possible silent stroke. Many people associate this sensation with poor circulation, poor posture, or even the fact that they slept in an uncomfortable position. However, when this tingling arises repeatedly, without an evident cause, it can indicate that small areas of the brain responsible for sensitivity are being affected. This symptom usually lasts a few minutes, which causes many not to give it due importance. Besides the tingling, some people notice a slight numbness in their fingers, hand, face, or leg. Even if it lasts a short time, this type of sensory change should not be ignored, especially in people over 50. The brain sends this warning when some part of it isn't receiving oxygen adequately, even if for a short period. Identifying these small signs can avoid more serious problems in the future. And in the next topic, you will discover a warning that appears and disappears quickly, and precisely because of that, almost no one takes it seriously. Alert 6. Vision problems that appear and disappear. Sudden vision changes, even if they last only a few seconds, can be one of the most dangerous signs of a silent stroke. Some people report seeing everything blurry for moments. Others notice dark spots in their field of vision or have difficulty focusing on objects. Since these episodes are brief, many believe it is just eye strain or too much time in front of screens. But when this occurs repeatedly, especially in only one eye, it can be an indication that areas of the brain responsible for vision are being temporarily affected. Another important detail is when vision seems to oscillate, as if there were a small delay in seeing clearly. This type of visual change is usually a warning that something is interfering with the communication between the eyes and the brain. Even if the symptom goes away on its own, it leaves an important message about neurological health. Paying attention to this sign can be decisive in avoiding major damage. And if you found this warning worrying, the next one will show how specific headaches can reveal even more about the state of your brain. If this content is helping you identify important signs, take a moment to like the video and subscribe to the channel so you continue receiving essential information to take care of your health. Alert 7. Headaches different from the usual. Headaches are part of many people's lives, but when they appear differently from the usual pattern, one needs to be alert. A more localized pain, which appears suddenly and vanishes without explanation, can be one of the subtle signs of a silent stroke. Often, this pain isn't intense, but has an unusual characteristic, like sudden pressure in a specific spot of the head. Because it is fleeting, many people simply ignore it, believing it to be tension or tiredness. Another important point is noticing when the pain comes accompanied by a sensation of mild confusion or momentary difficulty reasoning. Even if this lasts only a few moments, it can indicate that small areas of the brain are suffering temporary interruptions of blood flow. These different headaches deserve special attention, as they can be one of the last warnings before more serious events happen. And in the next topic, you will understand why some risk factors make these signs even more dangerous. Main risk factors after age 50. As years go by, the body goes through changes that make the brain more vulnerable to small damages, including silent strokes. High blood pressure, high cholesterol, and diabetes are among the main risk factors, especially because they silently attack blood vessels. Many people live with these problems for years without realizing they are directly affecting brain health. When uncontrolled, these factors weaken arteries and increase the chance of momentary interruptions in blood flow to the brain. Another point of attention is lifestyle. A sedentary lifestyle, excess salt in the diet, smoking, and constant stress accelerate the body's wear and tear and contribute to the appearance of brain microlesions. These factors, added to natural aging, make the signs of a silent stroke even more dangerous, as they indicate the body is already overburdened. Understanding these risks is fundamental to act before the signs become more serious. And in the next topic, you will discover how to identify these events early and when it is crucial to seek medical help. How to identify it early and when to seek medical help. Identifying a silent stroke early requires redoubled attention to the signs the body sends. Even if symptoms are subtle, when they repeat, such as tingling, memory lapses, changes in speech or vision, it is fundamental to seek medical guidance. Exams like an MRI can reveal microlesions in the brain that do not appear in common exams. The sooner these changes are detected, the greater the chances of preventing greater damage and avoiding more serious strokes in the future. Another essential point is to seek immediate help when signs appear suddenly, even if they disappear in a few minutes. The brain never suffers an isolated impact. Each silent episode increases the risk of the next. Recognizing these warnings and seeking care can prevent permanent damage. In the next topic, you will understand how all these signs connect and what the decisive step is to protect your health permanently. If this content is helping you take better care of your health, take a moment to leave your like and subscribe to the channel. That way you continue receiving valuable information that can make all the difference in your day-to-day life. The decisive step to prevent a silent stroke. Now that you know the main warnings of a silent stroke, it becomes clear that the greatest danger lies precisely in the subtlety of these signs. Nothing is exaggerated, nothing is obvious, and that is why so many people only discover the problem when they already face permanent consequences. Observing one's own body, respecting the signs, and seeking medical help when something deviates from your pattern are attitudes that can protect your brain for many years. Knowledge is the key to avoiding surprises and preserving your independence. The decisive step is simple. Do not ignore symptoms that appear and disappear without reason. Small lapses of memory, speech changes, sudden blurred vision, mood swings, or recurring tingling should not be treated as age-related issues. Most of the time, the body warns before something bigger happens. Taking care of vascular health, keeping exams up to date, and adopting a balanced lifestyle are attitudes that make all the difference. Keep following the channel's content to stay informed and strengthen your health with every video.